My name is Dr. Judith Joseph, and I'm a Child and Adolescent Psychiatry Fellow at the Child Study Center. Thank you for joining us for our Grand Rounds lecture series, where we get to talk with the experts in the field of child and adolescent psychiatry. Today we have Dr. Becker-Weidman from the Center for Family Development. He's an expert in developmental attachment. Thank you for joining us today.
Thank you for having me.
So what is attachment, and why is it important?
It's a biologically based system that really developed to ensure the survival of the human infant. So when a child is threatened in some way, or uncomfortable, hungry, scared, the attachment system gets activated, and then in simplest terms, attachment behavior is proximity-seeking behavior. The child wants to gravitate to their primary caregiver, who comforts them, makes them feel safe, takes away the fear, makes them feel better. Then the attachment system stops, it's not activated, and the child goes about their business. As an adult, your primary attachment figure now may be your partner, your spouse, or somebody like that. But we always have somebody or some group of people that make us feel safe and secure, and that's really what attachment is about. It's about the place, the person that makes you feel safe, secure, and comfortable.
Wow, and sometimes you have parents saying, something that happened to my kid years ago affects them now. How is that?
The reason for that is that early experiences dramatically affect and shape the brain. Our brain is what's called an experience-dependent organ. Your brain is influenced by experiences, and much of brain development occurs after birth. So early experiences affect what connections occur among different parts of the brain, whether they occur, and how strong they are. So the child's ability, for example, to control or regulate their emotions is determined by the strength of connections between certain brain parts, and early experiences affect that.
So because the brain is so closely tied to all of these things, is it possible that poor attachment can affect the way the child performs in school?
You can sort of think of it this way. We have a limited amount of mental energy. If it's bound up in anxiety and fear about safety and security, or bound up with all of the negative experiences that are still coloring the child's life, there's less of that available for things like learning, memorizing, problem solving academically. The other way that it can be profoundly affected is because these early experiences affect different connections among the components of the brain. The child's ability to move information from working memory to short-term memory to long-term memory to permanent memory can also be impaired. And then a third way is that children who've experienced chronic early maltreatment, their stress response system is always activated. And the stress response system is focused on survival. So these early experiences keep the child's survival brain constantly activated, and the learning brain, not so much.
So it sounds like problems with attachment can be really serious. What can we do about that?
The nature of the care is a critical component of treatment, and that treatment has to be responsive, attuned, and attentive. The other component of treatment would be attachment-focused treatment for the family that would help the child resolve these early traumas so that they stop. You can kind of think of it as these early traumas create lenses through which the child views the world, and these lenses are distorted by those early experiences. Treatment will help correct that and help the parent learn how to help the child correct that.
Wow, so it sounds like the parent is a really important part of this treatment. But what if the parent has their own issues that kind of get in the way of this treatment?
In that instance, we would work with the parent to help them resolve those issues so that they can be the kind of parent they would like to be.
Thank you so much for speaking with us today. We learned so much.
Thank you for having me.
And thank you all for tuning in.